Welcome everyone. Today is practical safety class. We're going to connect the handouts that I just handed you on hyperglycemia, hypoglycemia, sick days, with real life steps patients can take at home. We're also going to do a simple hydration support demonstration today. Did everyone get a snack? Yes. Good. Did you notice? Take a look at the snacks that we have today. First, let's look at our fruit cups. So, all about hydration today. Our fruit cups have watermelons, strawberries, and cucumbers. These foods are naturally high in water content, which can be a great choice when you're trying to stay hydrated. When people think about hydration, they usually think about what they're drinking, but many foods can contribute as well. Next snack we have is the cheese and crackers and the hummus. When we're recovering from an illness and our appetite starts to come back, it's important that we begin to add fiber and protein back in to our meals. Hi. Hey. These foods can help provide more lasting energy and keep us feeling satisfied longer than carbohydrates alone. And finally, we have our dessert makeover. So today it is chickpea chocolate chip cookies. In the previous classes, I made the black bean brownies, the sweet potato brownie bites. Today's cookie is another example of how we can take a favorite treat and make it better by adding more fiber and reducing some of the less nutritious ingredients. The goal isn't to eliminate desserts, it's to make small improvements that add up over time. Did anyone try the cookies?
Not yet.
Brian, did you try the cookie?
Yeah.
What'd you think?
They were good.
Could you see yourself eating that, something like that?
I like the brownies.
You like the brownies better? Well, we're trying everything, right? So, but there was no sugar in that. Only sugar is just a little bit of maple syrup. Okay?
Can you use monk fruit instead of maple syrup?
Of course. Yeah, any kind of sweetener, low calorie, low sugar sweetener, yep. So one thing I do want to emphasize on today is the snacks and the examples. These are balanced choices. They are not what we should use to treat low blood sugar. If somebody has low blood sugar and is truly low, we need a fast-acting carbohydrate first, okay? And then once the blood sugar is back in a safe range, then we can add the balanced snacks to help maintain it. Now let's talk about how to recognize highs and lows and what to do when you're sick so we can prepare you before the problem happens. That's what today's class is going to be about, okay? Sick days and how to take care of your blood sugar, okay? So the goal is to not memorize everything. The goal is just to have a simple plan for your sick day, okay? You already have the symptoms flyer. Today we're going to just bring all those pieces together, okay? So we're going to talk about spotting the symptoms, recognizing the symptoms of highs and lows, knowing the safe steps to treat it, knowing how to treat your low, making a sick day plan. I want you guys to have a little checklist. I want you to have a little box of stuff that you can grab when you're sick, so everything's right there. And then staying hydrated, that's very important. We can make diabetic friendly electrolyte drinks, zero sugar drinks. I'm gonna show you how to make one today with stuff that you probably have at your cabinets at home, okay? And then call early, know when to call your team, know when to call your primary care doctor and find out if everything's okay, if you need to go to the hospital or get fluids or something, okay? The thing is to not wait until it's an emergency. Okay. So why does the blood sugar get off track? As you know, many things we learned can make the blood sugar rise and drop. And sometimes the patients can feel like the highs or lows means that they failed. But blood sugar is affected by multiple other things: illness, stress, food, activity, medication timing, and hydration. So a lot of these things can cause the blood sugar to rise. We talked about stress hormones. Illness can make the blood sugar go up. Also certain medications, if you're on steroids. Dehydration can make your blood sugar go up. And then let's talk about what can make it drop. Skipping meals, having too much insulin, like over-treating yourself, being more active than you normally are and not having enough glucose to help with that, drinking alcohol, or just not drinking well when you're sick. So the goal is to just notice the patterns early, treat it safely, and write it down. And then call someone before it becomes a crisis. So I'm going to hand you guys out these flyers. This is all the symptoms for hypoglycemia, low blood sugar. These are great flyers. I like them. They're in color. You can put them on your refrigerator. And it tells you all the symptoms and also tells you what you can do to treat it. You guys want to share? Okay. When we talk about low blood sugar, we're generally talking about blood sugar that's below 70, okay? Look at your symptom sheet. Has anyone ever felt any of these symptoms? You have? What symptoms have you felt?
Shaky.
Shaky feeling? And then what did you do?
Ate a candy bar.
Ate something? Okay, very good. Anyone else have any other kind of feeling? What kind of feeling did you have?
Well, I found out that I can't even go below 100, and I feel shaky.
You start to feel some symptoms?
Dizzy, little black spots all over the place, and so now I don't go under 100.
Good. Do you guys carry stuff with you in case you drop?
Yeah, I
Good.
carry a lot of dry fruit, like cranberries, or
Okay.
dates, or something.
Okay, good, good. So treating a low, it's called the 15-15 rule. So you need to eat or drink 15 grams of a fast-acting carbohydrate. So some examples are these glucose tabs. They have them at the pharmacies. They have tabs and they also have a gel pack. About 4 of those tablets will get you 15 grams of carbohydrates or 1 whole gel packet. You can also have 4 ounces of juice or 4 ounces of regular soda, not diet, some hard candies. So what you would do, you would eat that, and then you would wait 15 minutes, recheck your blood sugar. If it's still below 70, then you're gonna repeat the whole process with another 15 grams of fast-acting carbohydrates, okay? One important point is foods that contain fat, protein, or fiber are not the best choice for treating low blood sugar. For example, cookies, peanut butter crackers, and chocolate bars and ice cream, they're gonna raise the blood sugar more slowly because the fats delay the absorption. So the type of foods we wanna do is fast-acting glucose, okay? That's why glucose tabs and glucose gels are such good options. I always recommend to anyone that's at risk for low blood sugars to keep those tablets with them. They sell them in those little packs like that, and they can just stay in your purse. They don't get crushed. You know, they're great to have. They're inexpensive, easy to carry, and the thing with that is you know exactly how many carbs you're getting. I love the glucose gel too. It can be extremely helpful if you can't chew. You know, you just squirt it in the mouth and swallow. But now let's talk about severe low blood sugar. In some cases, severe low blood sugar is when a person is unable to safely treat themselves. They may be unconscious, they may be having a seizure, or unable to swallow, or just too confused to help themselves. In a situation like that, it's best to not force food or drink on them. The best thing to do is that's when the glucagon comes in handy. It's a shot that's given right into the leg during emergency, it's an emergency reaction. So that's only for severe hypoglycemia. And it also comes in a nasal powder. After that, family members, caregivers can carry those, but after that, an ambulance or emergency services should be called so the patient can get treated correctly. Okay? So, like we said, for the most important thing for today is treating our lows with 15 grams of fast-acting carbohydrates and then 15 minutes rechecking the blood sugar. Okay? Oh, someone's coming. Always being prepared before a low happens is one of the best ways to stay safe with diabetes. What do you guys currently keep on hand? You said you keep some dried fruit. What do you guys, anyone else keep anything on hand?
Lifesavers.
You keep Lifesavers? That's a good one, hard candies. Oh, wow, great. Hi, welcome. Percy, welcome, thank you. So we were talking about sick days and highs and lows blood sugars, okay? Get you guys some flyers. Okay. So we were just talking about low blood sugar.
Appreciate that.
Okay. Here you go, dear. We're just talking about the low blood sugar. Okay. All right, let's see. Percy, have you ever experienced any low blood sugar? Any low blood sugars?
Rarely.
No?
Rare.
Rarely? Okay. Good, good. Okay. So these are some examples, and this might be a good thing for you to take a picture of. These are all examples of fast-acting carbohydrates, 15 grams. So the glucose tabs that we talked about, 3 to 4 tablets. Some popular food choices, a little fruit juice box, a regular soda, a tablespoon of sugar or honey. Those are all going to bring you up quickly, and that's what we want, okay? The ones, candies and sweets, Skittles, Lifesavers, there's your Lifesavers on there. About 5 to 6 of those will bring you up. And then jelly beans. And then, yep. Good. Yeah, we kind of don't want to do chocolate because chocolate's going to absorb a little bit slower because it's got the fats in there and the dairy and stuff. So yeah, that's why we want to do these type of things. They're more fast acting, okay? Okay, so after the low, don't stop too soon, okay? The goal is to prevent another drop. The next step is if your meal is less than an hour away, you're going to choose a balanced snack. The crackers and hummus and cheese was a good option. That's going to bring you back up. That's a after the low snack box idea. So that's a good choice to bring you back up and keep you stable from dropping again. Okay? But remember, it's not for you to treat your lows with. It's for after your lows. Okay.
I have a question.
Yes.
So, I'm like her. If I go under 100, I feel miserable.
Do you? Okay.
Okay, so the question is, do I take it then, the Lifesavers, as soon as I go under 100? Because I feel terrible. If I don't take them, I am in bad shape.
So I would only take them if you're really starting to sweat and you're really feeling bad.
Yeah, it's that way under 100.
It is that way?
Yep.
Then I would, just to have them. But why are you getting that way? Are you eating multiple
very
meals
rare.
a day?
It's
Okay.
very, very rare.
Okay, good. Then that wouldn't bother me then if you take it when you're feeling like that. Because everybody's a little different and they adjust differently to low
Yeah.
blood sugar and high blood sugars.
My issue is not low. My issue is high.
Okay. Then that's why, because your body's used to it being so high that when you go low, it's like, what's going on? I don't feel right. You know what I mean? So you have to get your body used to it being at a lower number, and then you should feel better. It's going to take some time. Here you go.
Thank you. Like 3 years?
Thank you.
No, it should. You can.
I've been in treatment with that. I have 3 years and I can't get it down.
You can't get it down. Well,
I do exercise, I do diet.
what about your diet? Okay. Well, we'll talk a little bit.
You review my diet.
Okay, I'll talk a little bit about you too. You can let me know what your diet is to see, and I can see if I have any suggestions for you after class. Okay. All right. So I just handed you high blood glucose, hyperglycemia. So it can be quiet at first, but you have to understand the patterns. Okay. So look at your symptoms there. Has anyone experienced high blood sugar? I'm sure you guys all have. Yeah. What were you guys feeling like at that time? What were you feeling like, honey?
I'm constantly thirsty.
Thirsty?
All night, all day, doesn't matter.
Mm-hmm. That's the number one symptom.
My sugar's 150,
Mhm.
140. Trying to get it down, but
Trying to
I
get it
can't.
down.
You know, I'm having a hard time.
Okay.
But I'm
Constantly thirsty.
eating.
Mm-hmm. Yeah. Some people feel thirsty. Some people feel tired, and some people just don't feel anything at all. Illness may raise the blood glucose even when your appetite's poor. So you might think, oh, I'm not eating, so my sugar's going to be low. But illness can raise it too. So just be careful about that. Steroids and some antibiotics can also raise your blood sugar too.
A lot.
Absolutely. Yeah, steroids will really raise it. So you have to be prepared for that. And make sure you guys have a plan if you're going to be taking them with your doctor. Like, what should I be worried about? What number's too high? That kind of thing. And this is also why it's important to keep your numbers written down so that way you can check them, when you're sick to make sure that you're doing okay. Okay. So I want you to have some questions. You know what kind of questions to ask your provider. Hydration can be very helpful, but you have to be careful if you're on fluid restrictions or anybody like that, so you do have to follow your provider's advice for that. Especially if you have heart failure or kidney disease. Certain sodium restrictions. But this is just for generalized, not feeling well, staying hydrated, that type of thing, okay? Okay, so CDC recommends checking your blood sugar every 4 hours when you're sick and also keeping track of the results. That's very important because that way you can notice if you're trending high, trending low, and you can keep a check on that. Because there are some serious things that can happen if you stay dehydrated and you're sick. It's also important to have a sick day plan, which includes how often you're supposed to check your glucose, what fluids and how much you're supposed to take, medication instructions, and if you have any ketone, if you were advised to do any ketone testing. Your doctor would tell you if you have to do that. Okay, so ketones. Does anyone know what ketones are? Yes, you do? Have you had it before? No?
But I know what it is.
But you know what it is? Absolutely, yeah. It can be very scary. It can be a life-threatening emergency. It is extra sugar spilling into your urine. And it can cause DKA. Most people with type 1 diabetics get it more often, but also insulin-treated people can get it too. You just have to make sure that you're drinking fluids, because when you get dehydrated, that's when it happens. Make sure you're drinking fluids and just know when to call your doctor to seek help. These are some symptoms that you may have: trouble breathing, confusion, cannot keep liquids down, repeated vomiting, diarrhea. Those are all types of things that you are going to get dehydrated very quickly from. Okay. So this is what I was talking about, building a sick day kit. So take a look at these things. What of these things you guys already have at home? Do you have most of this stuff already? Yeah. So do me a favor, when you guys go home today, just get yourself a little box and just put some stuff in there. Put all this stuff in there. Make sure you add your medication list and keep it all in one certain place. So that way when you're sick, you can just grab the box and just, use it to take care of yourself. And you don't have to run around looking for a thermometer here, there, whatever. Because when you're sick, you can't remember where things are. Okay, perfect. So what we're gonna do now is we're gonna make a simple homemade hydration drink together. When most people think about hydration, they think about a sports drink. Electrolyte packets, or fancy products that they see advertised online. While these products can have a good place, many of them are expensive and contain quite a bit of added sugar. Today I want to show you that staying hydrated doesn't have to be complicated. Our recipe uses just a few simple ingredients. I have it over there too on the table for you. It just basically uses water, lemon juice, a small pinch of salt, and a tiny amount of maple syrup. The water provides the hydration, the salt is going to provide the sodium, the lemon adds a little bit of flavor, and we're only using a very small amount of maple syrup. Not because we want a sweet drink, but because a small amount can improve the taste and encourage people to drink more fluids. As I mix them all together, I want you guys to think about what happens when you're sick at home. Many people don't feel like eating or drinking, and they have fever, they're vomiting, they're losing their appetite. During those times, it's most crucial to stay hydrated. Hydration isn't only about drinking water. Certain foods can help too, and that's what we talked about today. We included watermelons, strawberries, and cucumbers. They all have over 90% of water in them. So those are a great option for you to add to your diet if you're not feeling well, okay? All right, so let's see. So I have some water pictured here. Then I got some salt. Okay, so about like a pinch of salt or like 1/8 teaspoon of salt is all you really need. You don't want to make it too salty.
What if you don't have salt in your house?
I would recommend getting just a little bit just in case, because it's a really good thing if you're dehydrated.
Because I haven't eaten salt since I was 13.
Yeah.
Can you still do it without the salt?
Huh?
Can you still do it without the salt?
I'm sorry, I didn't.
Can you make it without the salt?
No, you need the salt because the salt's going to add the sodium. Okay? And here we go. Some lemon. Okay.
Do you use the
Limes?
in the
Yes?
containers?
Yes, you can. I like fresh, or you can use limes too, whatever you prefer.
Well, you don't get sick at all from the lime
If you're making just one little one for yourself, you don't have to use a whole, you can use like a half a lemon, but I'm making a big picture for all of us. Okay. And then, oh yeah, I want to touch on this. So this is a regular Gatorade. I'm going to pass this around. It's got 34 grams of sugar in that. Take a look at that. That's what people would reach for when they're sick. So this is what I'm going to show you a little bit better. Oh my gosh, I forgot my maple syrup. I got to run right back. Okay, sorry about that. Okay. And I'm just going to do not very much, just maybe a teaspoon of maple syrup. Okay. Just put about a teaspoon of maple syrup in there. Mix it all up. If you were making it for like a daily drink, you don't have to add the sugar or the maple syrup. You can just add the salt and the lemon. That's perfect. And let's get some ice. Okay. Let's see. I'm going to try it.
Yeah. Thank you.
Mm-hmm. Welcome. What you think?
Good.
Can you taste the maple syrup? No. No? But it's just like a nice, does it encourage you to drink more?
No, the cucumber, or the lemon.
The lemon's good?
The lemon juice.
I put lemon in all my stuff.
Mm-hmm. So this is like, you guys all heard of liquid IV and LMT, that kind of stuff. It's very pricey. This is simple. Simple that you can make right at your house. Carry it, probably most of that stuff.
Low sugar, right?
This is if you're sick and you think you're dehydrated. It's got the salt in it. This is not for low sugar, no. This is for just treating you if you're sick and you think you might be dehydrated. I gave you one. Here, go, sir. Okay, and then one more. Okay. All right, and I'll try a little bit too.
I'm surprised you don't taste the maple syrup.
Mm-hmm.
You don't taste it?
Or the salt, really, right?
I really don't, considering I'm
Yeah.
sensitive to it.
It tastes almost like an LMT to me, like the packets you can get over the counter. And another thing too, if you really want it to be, fancy, you can get like the sugar-free packets of stuff and use that with it. Put a little bit of flavoring of that in it. Yeah, so you're not going to drink Gatorade no more, right?
I used to drink the
Good. Good. Okay. So I also just want to point out this drink is not intended to replace medical treatment. It is or specialized oral hydration, specialized oral rehydration solutions. This is just an example of a low-calorie, low-sugar hydration option that can be used part of a healthy lifestyle, and if you're feeling mildly sick, okay? It's been hot out too. If you're working in the yard, make yourself a little glass of this, after you come back inside. Okay, so we talked about that. This is a big picture you guys can do. This is one you can keep in your fridge. Basically what we just did, okay? All right, okay, yes, so these homemade drinks are just for general education and mild hydration support only. They are not prescription, they are not substitute for medical advice, medical grade oral rehydration, or emergency care. Follow your provider's instructions, especially if you have diabetes, kidney disease, heart failure, fluid restrictions, high blood pressure, pregnancy, sodium, potassium restrictions. Call your provider or urgent care if you cannot keep fluids down, have repeatedly vomited or diarrhea, have confusion, chest pain, trouble breathing, or very little urination. Okay? All right, so what we have here is the after snack box, the after low snack box. So this is what we're talking about we had today. The crackers, the cheese, cucumber slices, hummus is good, and then you have your water or your electrolyte mix that we just had. So we want to treat, remember, we want to treat the lows with fast-acting carbohydrates. Then we reach for the balanced snack to keep the blood glucose steady. So say you don't have any cheese, that's fine. Get some Greek yogurt or a boiled egg or a turkey roll-up or anything with protein in it. Protein, fat. Remember we talked about no naked carbs, okay? Okay, good. Hope I have enough. If I don't have enough, we might have to, okay, thank you. I just want you guys to do it together anyways, just kind of talk, we can talk it out.
You can skip me. because-
Okay. You guys go, thank you. Got more people than I thought. I just want you guys to kind of have this in your thing. I want you to, when you feel low, write down what you're gonna use. If what your fasting sugar should be. When you're sick, when you should check your blood glucose, and when to call the office. Okay? So I also want to talk about some stuff that we should keep in our pantry for sick days, okay? So a couple of staples that you can keep, some crackers.
And there are low carb crackers.
Yeah, these are not bad. I picked these up yesterday. They got 2 grams of sugar in it. So, but they're wheat, so that's good. Also, some unsweetened applesauce and some broth. These are all really good things to just have in your cabinets that you can just keep. You don't have to worry about them really going bad. Bone broth's a great thing, you know, when you're not feeling good to get hydration and also to get some protein in you. Peanut butter and applesauce too. Make sure it's unsweetened because applesauce can have a lot of added sugar to it. So what do you guys think about, you guys have a blood sugar plan now you're thinking about now? Anybody? What do you think?
All that in my house anyway.
You do? Good.
Except the peanut butter. I'm not a peanut butter eater.
That's fine. Whatever you can replace the peanut butter with.
I do a hard boiled egg.
That's good. It's a good protein, yeah. And they're easy to keep too
Yeah.
in the fridge, yeah. Very good. Okay, let's see. So 3 rules that I want you guys to take home from today's class is I want you guys to treat the lows quickly and safely, okay? So how are we gonna do that again, remember? Who wants to tell me? How do we treat a low?
Orange juice.
Yeah, 15 grams of fast-acting carbohydrates, very good. Orange juice is perfect, little 4-ounce things of orange juice. During an illness, we're gonna check our blood sugar more often. The CDC recommends every 4 hours and to keep track of it, okay? Sick days, you know that you need more monitoring and more hydration if you're sick. And persistent symptoms and unsafe numbers, you have to call your doctor, okay? All right, do we have any questions? How often do you guys, yes, honey?
Is this better than the warm water with sugar and salt?
What's that for? Warm water
To
for
raise the sugar.
So the drink that we made is not to raise the blood sugar. The drink that we made is just for like hydration. It's like a liquid IV or something.
Yeah, when you're gonna.
It's not when you're gonna be low on your blood sugar. If you're low on blood sugar, if you're not feeling well or you feel like you're gonna pass out, you need to eat candy or you need to eat orange juice. This drink is not gonna be enough, okay? This is only for if you're dehydrated and you're throwing up a lot or having a lot of diarrhea and you've lost sodium and your electrolytes, that's gonna replace it, very mildly, okay?
This drink would even help with high blood sugar.
Yeah, it could.
Well, I used to look at, and the people's blood sugar gets so low, the nurse gave them some graham crackers and orange juice. To drink and graham crackers, they eat that brought it back up fast.
Yeah, the orange juice will bring it up real quick.
And the graham crackers too, because graham cracker has blood sugar.
Mm-hmm. Yep, exactly. Yep. So I'm excited to talk about next class. We're going to be branching out into more metabolic health, the big picture. It all goes together. So we did everything about diabetes. So we're going to talk about diabetes, sugar. We're going to talk about blood pressure, cholesterol, weight, and just daily habits. So it all goes along with having diabetes too, okay? I wanted to ask you guys, was there anything that you wanted me to touch base on? I know the lady that asked me last time about Tai Chi walking, she's not here, but I am going to do a class on that, Tai Chi walking. Has anybody tried that before?
No.
Would anyone be interested in that?
I would be.
Okay.
What is it?
It's a walking, Tai Chi walking, but it's walking and moving your arms. It helps with balance and core and all kinds of stuff. So it's really good exercise. Dr. Mahajan's recommending it to everyone now. So I figured, I was like, somebody asked me about it, and I figured I'd research it and do a little session on it or something. Okay. And, oh, Mike's not here. Okay, because I found out about the Fresca thing. Let's see, anyone else ask me questions last time?
I did.
What did you ask me, honey?
I asked you about the app on the phone.
Oh, yes. I'll talk to you about that after class. Yes. Okay.
If your sugar, my sugar is high in the morning, but then when I check it, like before I have dinner, 2 hours, it's low, even though I've eaten all day. What makes it change like that?
It's constantly going up and down, depending on what you're doing too. How active are you?
Not very active.
Okay.
I
So
should be more, but I'm not.
make a little food diary and document what you eat. Maybe you need to eat like smaller meals, like snacks in between. So that way you won't be going low at night. You'll keep it more stable. We want to try to keep it more stable. We don't want it to dip or drop or raise, you know. So eating snacks every couple hours, even if it's little snack, you know, cucumbers, hummus, crackers and hummus, something like that, it'll keep your blood sugar more stable. Try that, okay? So yeah, our next class is going to be July 8th, and I hope everyone can join us. And then one more thing I just wanted to say. I wanted to say good work, Percy. Congratulations. Percy came from an A1C of 8.6 to 6.6. Very good job. That's amazing. Good work. I mean, 2 points, that's huge.
How'd you do that?
I don't know.
Maybe my class?
That's in January and,
He doesn't remember.
January was 8.6, and this was just in June. You just had it done the other day.
Wow.
yes.
Did you even know your result yet?
Yeah,
Okay.
I was telling you that I wanted a 5.
I know, but that's still, hey, that's great.
Yeah.
We're very happy with that. You should be happy too. It's below 7. That was your goal
Absolutely.
when you started the program, remember?
Yes, ma'am. Thank you.
Very good. Okay. Any other questions? No? Okay. All right. Thank you everyone for joining us. So